welcome back to Fitness in Your Mouth. I'm DJ Madsen, and today I have a very special guest. We will be talking about GLPs, their medical application and use as performance enhancing drugs. Can you give us a brief introduction?
Hi, I'm Dr. Jamie Gilliam. I'm a doctor of integrative medicine, which is not an MD. And what that means is it's similar to functional naturopathic medicine. We look at the body as a whole and we look at all treatment modalities when we're considering treatment options, which also includes conventional care, medications. And it's just about treating the whole person. And I became a doctor of integrative medicine after my own personal struggle with thyroid cancer and then hypothyroidism, Hashimoto's, lupus, and just wasn't getting the help that I needed from my healthcare providers. And so I started digging deeper and trying to learn more about my body so that I could help myself.
And you make a lot of content not only on hypothyroidism, but more modern approaches to treating thyroid issues, as well as use of GLPs outside of the use in diabetics or those clinically obese, and more practical application in other demographics like those with PCOS as well.
Yeah, there's a lot of off-label use right now, and there's some study on off-label use. There's a lot of studies underway for treating inflammatory conditions, PCOS, hypothyroidism, any kind of endocrine problem. GLPs can really enhance treatment, and then also brain diseases, addiction, heart disease, liver issues. They're being used for a lot of different things because of how they work metabolically in the body. Also, obviously, because they are helping people to manage nutrition better, reduce calorie intake, which can help to reduce inflammation and help with overall bodily functions.
And right now we have two primary GLPs that we're seeing on the market that are branded. And of course, there were available compounded. Depends on where you're going. I know Eli Lilly's throwing a fit, so it depends on whether you can get them or not. But typically we're utilizing semaglutide, tirzepatide, and more recently, even though it's not technically approved yet, we're seeing a rise in popularity in retatrutide. So out of these three, which ones have you found are ideal in terms of efficacy, or do you have different use cases for each one?
I personally prefer tirzepatide or retatrutide over semaglutide. Some people call it semaglutide, only because tirzepatide is a GLP-1 and GIP receptor agonist, and then retatrutide has a glucagon piece of it as well. And what I've noticed with semaglutide is it can cause depression. We've seen more reports of depression, severe depression in patients with semaglutide over tirzepatide and retatrutide. I think the side effects are much more severe with semaglutide, and overall just better patient outcomes with tirzepatide and retatrutide. Retatrutide is in phase 3 of clinical trials. So obviously it's not on the market yet other than through the gray market. It does show to have the best outcomes for patients over the other two from what I've seen. And the problem is with the semaglutide, still great for some patients. It's just, it only is a GLP-1 receptor agonist, and then the nausea, the digestive issues, the heartburn, and some of the more serious risk and side effects that can occur are reported with semaglutide than with tirzepatide, retatrutide. However, some of that has to do with the dosing, because we know people are overdosing and misusing GLPs, and then also lifestyle management plays a huge role. What you're putting into your body is going to play a huge role in the side effects that you have when using a GLP.
I think a lot of what we're seeing is kind of questionable territory. Is it going to be side effect or is it going to be efficacy? So many people utilizing semaglutide, especially because that's going to be, unfortunately, first course of action. If we're looking at a GLP, that's almost always going to be the first one deployed in conventional medical care. And definitely not my favorite. And it's the side effects we're seeing. People say, well, I lost 10 pounds in a week. And I'm like, well, that's because you couldn't stop pooping and you were vomiting and you ate nothing. You ate a boiled egg this week, you know? And I think some of the side effects and that really intense delayed gastric emptying we see tends to yield. And that might be why we're not seeing such a great outcome as we do with like tirzepatide and retatrutide, is because we have an enhanced side effect profile. Now, tirzepatide is a glucose dependent insulinotropic peptide agonist as well, we see not only reduced side effects with tirzepatide, it seems to be handled a lot better, but it does, I think the way that we're seeing them administered kind of changes that Cmax curve, especially with Retta. It is only underground right now. It's that gray market. So most of us that are using it, especially providers that are taking more holistic approaches and homeopathic providers, tend to use microdosing. So, long term patient outcome, reduced side effects with microdosing means your patient stays on it longer, gets better results. I think that's one of the huge reasons we're seeing such good outcomes with Retta. Not only is it a superior compound because it's a triple agonist, but it's well tolerated because of how we're administering it. So, with your patients, do you always do the standard once weekly or do you split that up as well?
So we actually don't have many patients on higher dosings of GLPs, and we educate on the benefits of low dosings or staying at a starting dose if you need a starting dose. Very few people need the higher dosings, and then we do have some people who are split dosing, doing microdosings twice a week, and some people have really liked that approach. Some people have not, and I think the biggest thing is more is not better, and more can actually lead to health problems and worsen your health versus making it better. And we actually have a patient chat room, and our patients chat. And I've had to get into discussions a few times now because they start giving each other advice, and patients want to increase their dose because they think it's going to give them faster, better results. And that's not necessarily the case. And I think one of the problems is people want fast weight loss. And you didn't get to 250 pounds overnight, and you're not going to lose the weight you're wanting to lose overnight. And
They don't
then
like it when you say that part.
no, and patience, consistency over time is key. And if you're in an extreme deficit over a period of time, then you're losing more muscle mass. You run the risk of causing bone density issues, and you're going to have way more loose skin to deal with typically. And then if you're not strength training or doing some kind of resistance training and getting adequate protein, it's a problem. And I've had patients say, I don't care. I don't care about muscle loss. I don't care about bone loss. I just want to lose weight. And I've been heavy my whole life. And my response is, when you fall and break a hip, when you can't recover from a hip surgery, then you're going to care because you need muscle mass. You need your bone health. You need to be able to live a long, healthy life. And being thin does not mean being healthy. And there's such a misunderstanding of what true health and wellness means, and that it's not just about your body weight, body composition, and you have to take charge of your own health. Even if you're taking a GLP, you cannot rely on a GLP for your health. You have to put in the effort and do the things that are required, which we have
The
foundational
hard
things that will
stuff.
never change, which is your diet, your exercise, your sleep, your stress management. Those things will never change when it comes to foundations of health and wellness.
So for those utilizing GLPs, I consider three primary use categories. Those that have medical necessity, those that may have medical necessity and they're abusing it. They're not using it as a tool, making all of those lifestyle changes you're mentioning. And then we have those that are abusing it as a performance enhancing drug that have no medical application and no requirements for fat loss. So, in your eyes, and especially with the demographic that you service, who is a candidate for medical application GLPs?
So, when it comes to what is FDA approved, it's going to be type 2 diabetics and people who meet a certain BMI and are in the obese category. Anything outside of that is going to be off label use. And when we're working with patients, the first thing is not to put somebody on a GLP. And if somebody wants to start a GLP with other treatments, they can. But often what I'm telling them is, what we see in your lab work right now, we need to focus on these things and addressing these things by getting on the proper thyroid medication or going on hormone replacement, adjusting lifestyle, doing some supplement support. And then if you're not getting results with your treatment protocol, you're still having inflammation, you're still struggling, then add in a microdose of a GLP and start there. And if they want to start out with a GLP with their other treatment protocol, they can, but sometimes I think using GLPs are problematic because they can also mask underlying things that
Mm-hmm.
are going on. And so people never get the proper treatment. While GLPs can indirectly impact thyroid function and impact liver health and many other things in the body, many people need direct treatment for hypothyroidism, for PCOS, and for inflammatory conditions. And so we want to go in steps so that we make sure that people are getting the right total body care versus just using a GLP and depending on that, which then can mask underlying things that need treatment directly.
And it can worsen a lot of issues. And this is, you know, how I feel about this topic, because we talk about this a lot, and like the importance of blood work. And this is your area of expertise, looking at overall sex hormone health, looking at well balanced hormones, especially if we're in a peri or postmenopausal state, addressing HRT issues and managing thyroid. I always tell people, before we get on a GLP, like, let's make sure there's no signs of like metabolic dysfunction that we can take care of. I had someone message me today and they said, well, I started Retta and I'm on a really high dose and I'm still not losing. Am I doing something wrong? And in one of the summaries that we talked about, it was saying, hey, I really think that since you've done these crash diets, calories have been low and you didn't have success with fat loss, you should probably get a full blood workup to include your hormones. Specifically, I'd like you to look at thyroid function, not just TSH. We talk about this a lot, but your free T4, free T3, potentially reverse T3. But like, let's do a full workup. And that part was never completed. So if you are already have a low basal metabolic rate, yes, the GLP is going to help suppress appetite and help you eat less, but there's going to come a point where you're not putting in adequate nutrients in your body. Doesn't mean your basal metabolic rate is going to be a safe zone for you to be in. So addressing all of those issues before the GLP also ensures long-term success and health with the GLP as well. So when you are utilizing this off label, but we still see excellent medical application, can you tell us how this can enhance people that maybe are dealing with hypothyroidism, but maybe can't leverage those free T3 levels? They're very sensitive to stimulants, maybe to get into optimal ranges, or maybe someone with PCOS.
So, one of the things with hypothyroidism is it disrupts a lot of metabolic processes. And even when people are properly medicated, they can still struggle metabolically. And so it's a great enhancement. It's a great tool to add to thyroid medication. However, there are people who are very sensitive to T3. I've seen it. It's not common, but when we do see it, these people have adrenal issues and they're also high stress, tend to just be easily anxious,
Mhm.
and they also will tend to be sensitive to testosterone therapy as well. Sometimes progesterone therapy. There's some commonalities that we see in people that are sensitive to T3. We try to treat those things, but then there are some genetic components to that sensitivity that sometimes we just can't treat, right? And so GLPs, what you want to do, like you were mentioning, maximize basal metabolic rate and maximize everything you can within the body, and then use the GLP. And some people will need more help with the GLP. I've seen people where even when they're on a GLP, their glucose is running high, and we're their nutrition, we're tracking their exercise, and their glucose is still running high, so they may need a higher dose of a GLP. Now, you
Mhm.
can't hold somebody's hand and record them 24/7 to know exactly what they're eating and drinking and what their activity level is, but I have seen a handful out of thousands where they just aren't getting results with a GLP. And we do see in their lab work where it's just not as effective as it is for other people. Is that stemming from something genetic or an underlying problem, or is it stemming from lifestyle? It's difficult to know, but there are different lab markers that will show that somebody's just not responding well. And the thing about GLPs is they cause you to not be hungry, and they will reduce calorie intake, but they're also reducing inflammation in the body. They're helping with glucose regulation, with metabolic processes. They're slowing gastric emptying. They're doing a lot of things internally that yes, tell your brain you're not as hungry, but also helping your body metabolically to be able to create a consistent calorie deficit. But I've seen people where it just is not working. And that is typically a thyroid related issue,
Mhm.
hormonal issue. It could be that even though their brain's telling them they're not hungry, they're still overeating, or they could be eating calorie dense foods. So maybe they've reduced their intake volume, but they're still consuming beverages high in calories, foods high in calories for a little amount. And then there are a few rare conditions where we do see that GLPs just don't work well. And those are very rare conditions that require some extensive testing, which most people aren't going to be able to get that testing. It's very expensive self pay, and most providers aren't going to run the testing. But there are a handful of people who just don't respond to GLPs well. It may make a little bit of a difference, but not where some of these people are losing 100+ pounds with the help of a GLP.
And we see so many benefits, even improvements in insulin sensitivity and those that might not actually have weight issues, improvements in triglycerides, inflammation. But a lot of people don't realize how many general population individuals really don't even need notable fat loss are using GLPs. And this is something that we have found, especially with the rise in popularity of gray market peptides. I know like every girl slinging at the farmer's market locally is selling GLPs at her garage here. So let's talk a little bit about the rise in popularity of GLPs for those that don't need it. And essentially, and this is a topic people don't like, but you can abuse anything. That's one thing that humans are really good at doing. And I don't think those, especially those that suffer from issues that would require a GLP, know how many people are taking them that don't need them and maybe aren't making those lifestyle changes, aren't trying to become a better version of themselves, aren't prioritizing long term health. Let's talk about what you're seeing in terms of outright abuse of these.
I'm a little shocked because never did I think that the performance enhancing drug world would hit the general population.
Oh, that's a big one right there. Performance enhancing drug. They don't like that, do they?
Well, I saw your post where a lady said I'm on it for type 2 diabetes. It's not a performance enhancing drug, and it is. It is enhancing your performance. It's enhancing your life regardless of why you are taking it, and it facilitates weight loss. And there's a lot of other benefits, but that's the main reason why people are using it. We've never seen a drug hit the market like this that has had this much interest, and now anybody has access to it. I think it's dangerous. I think that people have a lack of responsibility when it comes to understanding the risk and the side effects and proper dosing. People don't understand milligrams and milliliters and concentrations and the reconstitution of peptides. And I think people are overdosing without realizing it. And many people are overdosing knowing that they are overdosing. And they are good. They are good products for the right people when used properly. And we are going to see, I think, a huge downfall in the next 5 years because of the misuse and abuse of these peptides. And people are going to have significant health problems because of that. And I also think now we have influencers with no education, no background. I mean, even when it comes to you and I, your knowledge on performance enhancement, your knowledge of the body is much more complex than what my knowledge is. And we have two different types of knowledge when it comes to the body. I can't speak on the scientific level about the way that peptides work and performance enhancing drugs work like you can. And when it comes to catabolism and anabolism and aromatization, you know those things on a much deeper level than what I know, right? And so you've got all these influencers with no knowledge who are getting paid to be affiliates and to promote gray market peptides. Now they're recommending stacks, and now they're recommending all different types of peptides. And there are risks, and some people should not take certain peptides. And the goal should not be to keep stacking until you get the results. You have to know how to use these peptides properly. And then you have to know when you want to add something. Is it the right time? And is it going to give you the results you're trying to achieve? Just like, people were taking Anavar. There was a trend there for a bit where women were being given Anavar who don't work out at all, but they were taking it for fat loss and they had no reason to be taking Anavar. It was not the right performance enhancing drug for them. And so it's a problem because I think this is where we're getting into people ending up in the ER and ending up with serious health complications because they're just taking something because somebody on the internet said this is great and they're showing the benefits they've gotten. So then they're ordering research peptides and then they're not using them properly. And so it's a huge concern. And that's why for all of our patients, which many of them, when they get on consults before they're ever a patient, they're already taking a lot of gray market products. And we're having to educate them and explain to them proper use. And one of the biggest things is it's math. And some of us just aren't that great at math. People just don't understand that milligrams and milliliters are not the same thing. So when somebody says, I'm taking, 0.25 ml, and I'm like, well, what is that in milligrams? Like, I don't know what your concentration is of that peptide. So it's a problem.
There are people that are not only doing that, but they're adjusting their dosing off of it. I added 5 units. I was on 15, so 5 seemed like a good amount to increase by, and it makes my head want to explode. But I think, you touched on some very important subjects right there. I think people are not looking at the long-term health repercussions. Look at bodybuilders as well. You do anything for the gains when you're younger, but they're not necessarily looking at neurotoxicity potential and cardiovascular health in the long run. My biggest concern right now for everybody using GLPs is loss of muscle mass. We know how important muscle is as we age. And then, of course, especially in women, we're very concerned about bone density. So it's what we're doing in the short term that's going to impact us in the long run, especially when we are abusing it. A lot of the patients that have that medical need, they've exhausted their resources. They have a provider that's telling them, let's strength train, let's get in protein. But when you're buying it from GLP Mommy 15789, who's sharing her journey and is now selling peptides out of her fake Louis Vuittons in her garage, this gets really dangerous. And to me, it's mind blowing to see this merging of performance enhancing drugs and general population, because there's GLP chat, GLP talk. We're talking about injections. We're injecting on camera. And I'm from a bodybuilding background where I feel like we've been shunned and pushed into the caves because we take steroids. And it is offensive, I have found, to a lot of people to refer to GLPs as performance enhancing drugs. But the way people utilize them, a performance enhancing drug is any compound that is using to enhance physical or even mental performance beyond your natural capabilities. And so if you're trying to get into a lower weight class and you haven't been able to do it naturally before and you're a strength athlete, well, a lower body weight and higher strength ratios going to have a competitive advantage. And bodybuilding, when you're judged on conditioning and how lean you are, it's a lot easier to get that way when you're not hungry and suffering. GLPs, especially retatrutide, because of that enhanced metabolic rate, are becoming very popular in bodybuilding prep. And I'll tell you what, I've used it in athletes now, and it was a very weird, smooth prep. And used to, that hunger was almost like a rite of passage in our community. People will abuse anything, and there is medical application, and this is changing lives. It's so important. But, anabolic steroids also have medical application, and we need them in our cancer patients and our burn victims and people that are in a catabolic state, but we found a way to abuse those. So I think there's a big difference in using something off label and abusing it, rapid fat loss, overdosing, using this as an excuse so you can go to brunch with the girls and not gain any weight, versus what we see more athletes doing who are still abusing it, absolutely. But there's more of a safety net where we're looking at muscle retention, muscle development, and you kind of bridge that gap with your patients, because whether they're utilizing it to help with that calorie deficit, to help stay in it without extreme hunger, or there's medical application, you're training them on what to do to get the most out of the GLPs. Because at the end of the day, there's a big difference in how you use it, how you dose it, because you're not following medical titrations, right? You're doing it only as needed, as low as possible.
Yeah, if you're getting results on a lower dose, why increase the dose? And why run the risk of having a lack of nutrients because your appetite is so suppressed you can't eat? And one of the things I like about retatrutide is it doesn't suppress appetite in the same way that semaglutide does. And so you still are enjoying food and you're still able to get in nutrients, whereas semaglutide I think can kill your desire for food. You're not enjoying food when you eat it, you're just eating to eat, and then it can take away your desire for everything. And
Mhm.
retatrutide, it depends on the person, it depends on their whole makeup, how somebody responds. But retatrutide for a specific population is much better over tirzepatide or semaglutide from what I have seen. And I have used semaglutide, which I used it off label. I had an enlarged spleen and I was supposed to go on hydroxychloroquine. I didn't want to go on that drug. It's a pretty harsh drug. So I said, well, I'm going to try a GLP and went on semaglutide. And obviously, at the time, I was like, great, I'll lose some weight. I wanted to lose about 10 pounds. I was fit and healthy. But in my mind, I'm like, I'm going to lose a little bit of weight. This is going to be great. And the semaglutide, I'm talking about my personal experience and from others. When I talk about the depression aspect, it was to the point that I was concerned about myself because I had no motivation to do anything. And I started having some pretty depressive thoughts. And I do have ADHD. I think it was treating my ADHD. I was kind of flatlined
Mhm.
and I didn't want to get on calls, didn't want to go to the gym. I was laying around a lot. And so, I went ahead and stopped that and was going to stop a GLP. I tried retatrutide and it was a much different experience, no side effects, and my appetite wasn't suppressed. And by the way, I was on a very, very tiny dose, but on semaglutide, I was nauseous, like I was early pregnant the whole time.
Mhm.
And I was just miserable. And the retatrutide, what I saw is it didn't decrease my calorie intake as much, but metabolically, it works
Yeah.
much better on a metabolic level and it wasn't affecting my brain health. It wasn't affecting my mood. And so I personally like it. But here's the thing. Phentermine, women have and men have been addicted to phentermine. There's all different types of appetite suppressants. GLPs are not in the same category. They work differently, but they do suppress your appetite. But people can get addicted to anything and abuse anything. And that's what we're seeing. I have people tell me I'm never coming off of this. And then I have people who are adjusting dosing on their own because they are addicted to it and now they're abusing it. And like you talk about with performance enhancement and bodybuilders, there's been a stigma around performance enhancing drugs since I can remember. And that's why so many people won't talk about what they're using. And the body that somebody gets from using a GLP is different based on their lifestyle and their
Mhm.
training habits, their nutrition habits. And, there's a large creator who didn't tell the public for about 8 months that she was taking a GLP. And I can't think of her name at the moment, but she has gotten a lot of backlash because she came out and said, I've been taking a GLP and I was on it for health reasons and I have lost about 15 pounds. And people are just angry that she didn't say anything because she does sell fitness and macro plans. But she was fit and healthy before she started taking a GLP. And yes, it has helped her to facilitate weight loss, but she wasn't overweight prior to taking it when she was selling her fitness and macro plans. So I think she has an obligation to tell people when she has a platform and she
Mhm.
has lost weight and people are asking, like, hey, what are you doing? You've lost weight. She didn't say, oh, I changed my fitness program and I'm doing this now, or I'm eating this way now. She said, I've been using this GLP, and she was honest, but the amount of backlash she has gotten to me is insane because people say she lied, she's cheating. And in the bodybuilding fitness world,
We take drugs.
whatever you're taking, it doesn't negate from the hard work and effort that you put in. And you're not building muscle without getting out there and building muscle. No substance is going to help you create a certain body type. You can depend on a GLP at a very high dose and you can lose muscle and you can get really thin, and you're not creating a body composition with lifestyle. You're just depending on a GLP, and you can see it in people's bodies when they're not doing the lifestyle work required for the medication to assist, because it's a completely different look. It's a completely different body
Yeah.
composition.
A lot of people get on the GLPs, they lose the weight, and they're not happy with the outcome because they weren't strength training, they weren't prioritizing protein, and they had that equal lean mass loss and fat loss as well. Now, so you did semaglutide and you did retatrutide. Have you taken tirzepatide yourself?
I have not taken tirzepatide, but that's what the majority of our patients are taking.
So I never did semaglutide. I had no interest in semaglutide or tirzepatide, and I don't deal with any inflammation, so I had no off-label benefits for the tirzepatide for me. And then Retta came out, and I was like, I want to try this. And I think I also have an obligation. If I have clients that are utilizing it, I have an obligation to experience this myself. And let me tell you, best experience of my life. It
Mhm.
was incredible. And it was ultra micro dose throughout the week, early mornings. I'm one of those that's very sensitive to stimulants. Some people have changes in like HRV and sleep disruptions if they're taking those big once a week doses with the Retta. So I was very careful, little micro doses. The way that impacts you, it takes a little bit longer to get in your system. But I cut for like 6 to 8 weeks. I lost like a pound a week, wasn't hungry, felt great, had enough appetite to still hit my protein goals. And I always tell people, if you're using a GLP right, you should still have cravings. And there's a big difference. And this is where I think social media has blurred some lines. And I bet you hear this a lot, is I have food noise, so much food noise. It's always food noise. And there's a difference between chronic food noise that can lead to binge eating or polyphagia versus like really wanting food because it tastes good. We're human. We have taste buds for a reason. And so what I like to say with GLPs, what retatrutide helped me do, because I eat like a grown man, I was a bodybuilder, shouldn't, but instead of walking by a plate of cookies and being like, dang, I'm going to eat 10 of them, I could walk by the plate of cookies, still acknowledge I wanted a cookie, and have the discipline to say, I'm going to enjoy a single cookie after I eat this meal, or even just say no. But I still wanted the cookies. It was a fantastic experience. And then I did over suppress myself once towards the end of like, I think it was like week 7, maybe. That was a very good experience for me to feel that. I've never had acid reflux in my life. I didn't even know what heartburn was. And I thought I was having a cardiovascular event and begged my husband to take me to the hospital because I never had heartburn. He will
Yep.
never let me live that down. But I just ate too high a volume of a meal. But as somebody that microdosed it, didn't push the limits, controlled my rate of fat loss, didn't lose any muscle. I did DEXA scans. I continued cutting even after I got off. I've held that weight. It was a great experience. And I am a PED user. This was strictly performance. I didn't even have a reason to lose body fat. I just wanted better abs when we went to Cabo. So I am the person abusing it. But I took all of the steps that you preach. We ate our protein. We had our minimum goals. We were responsible. I didn't increase the dose. And Retta was a fantastic experience when I was utilizing it responsibly. I had, other than the one episode of heartburn, I did not have a single side effect the whole time. Is that how yours was too?
Yeah. And I think people have to recognize that if you eat high sugar, high fat meals or drink alcohol in excess, you're likely going to experience the heartburn and the nauseousness, some stomach pain because of your habits, right? And the thing for me, and here's the thing, there's this huge problem in the fitness space where these personal trainers do not understand metabolic health. They don't understand medical conditions. They don't understand that, yes, calorie deficit is required for fat loss. That's never going to change. And the game is the same, but the body that you're playing the game with can be different. And
Very
some of
different.
us need some help. And it's okay. And it's okay if your body is in pristine metabolic condition, but you just want some help. There's nothing wrong with that. It doesn't make anybody better because they can do it without the assistance, or they're gripping the side of the table and refusing to eat something when they're really hungry, versus somebody who's saying, I'm going to use this as a tool to help me. But we have this whole space where there's a lot of ego and, you're just not doing the work and you're just overeating and you're not exercising. And I think we just have to drown out that noise. And yes, the game is the same. and you have the ability to take charge of your health and you can make decisions for your own body. And we have treatments, we have things that we can use that help us because we get one life. And I'm going to tell you right now, I'm going to live the life that I want to live, and I'm going to make sure it's great because I'm not getting any younger. My husband's on retatrutide. It has been life changing. He's on testosterone. I'm on testosterone, progesterone, thyroid meds. I've used GLPs, and I'm looking at other peptides now that I can utilize. And it has been amazing for our health, for our relationship, for our lives. And we have more energy, and our biological age, according to DEXA scans, we're much younger on our DEXA scans than our actual age. And you know what? 10 years ago, we both owned a gym and we both were struggling with our health, and we're just in a much better place now. And one thing that GLPs did teach me, my BMR calculations are way off base. And what I could eat in my 20s and 30s, I cannot eat that amount of food now. So when people come online and say, "Hey, you need 2,000 calories a
The
day."
little macro calculator people that are on the live streams.
Yeah, I mean, your metabolic health, there's a lot that impacts that. And my basal metabolic rate is not as high as it used to be. And GLPs taught me that I do not need that much food. And also, I have always had a binge problem. I've had an alcohol problem and food binging problem. So I've always avoided like ice cream and cookies and cake. I just wouldn't touch it because if I had one cookie, I would want 10 more. But now I can actually keep stuff like that in my home, walk by it, and I'm not grabbing a cookie. And if I want a cookie, I have one cookie and I'm good. Or if I want an enchilada, I can go out to a restaurant and order enchiladas. There's 3 on a plate. I'm going to eat one and not all 3, and the rice and beans and the chips and salsa and the margarita. And I think that there is some reset that has occurred for me when it comes to the way I look at food and my relationship with food. And also, I'm just not as hungry as I used to be. Whereas before, I was ravenous with my appetite, but also I'm not killing myself in the gym anymore. I'm doing steady state cardio and I'm doing strength training. I'm not doing a gazillion cardio classes, and I'm not doing high intensity where I'm just killing myself with my workouts. So calming down has calmed down my appetite as well.
Mm-hmm.
And I've recognized some things about my relationship with food, relationship with my body, and also just how to manage better. Whereas before, you're kind of out there alone, like nobody's really teaching you. Nobody knows what you're personally struggling with because they're not living your life. So you have to learn more about yourself, your body, and where you're struggling. And that's the other thing. Side note, semaglutide took away my desire for alcohol like that. And I had been through coaching programs, I had been to AA, and I had gotten to where I was managing pretty well. But on the weekends, still, it was like party time for Jamie. Like once I would have a drink, it was, there's no stopping. But I had started drinking nightly after my mother died, and that's been 10 years ago. And it was a way of coping, and it just became a habit. And then I recognized that I couldn't stop. And so I was managing okay, drinking a couple nights a week and then heavy on the weekends, and then started semaglutide, not a thought about alcohol, and I didn't even want it. And that helped me tremendously to overcome, because I wasn't sitting on the couch like, I need a drink, but I'm not going to have a drink and go distract yourself. I was able to just say, I don't need it, I don't even want it. And that helped me be able to heal my problem with drinking. And I think it's fascinating for people that struggle with food addiction, binging, alcohol use. I don't know how it affects drug use and
I can
smoking.
tell you one of the biggest things I've seen on my men's health forum: porn addiction.
Really?
It has been life changing for so many of my male clients, because sometimes we have a combination of, we get into optimal testosterone levels, sex drive increases, the spouses might not increase at the same rate. And so then we're self soothing, taking care of things ourselves, and it can quickly become a dopamine spiral. I mean, just look at Instagram reels and TikTok in general. Then you throw in nudity and ejaculation, it's a recipe for disaster. That's something I've seen it help probably 20, 30 men now. kick pornography addiction. So it's extending to all reaches of addiction from what I'm seeing.
Well, it's affecting your reward behavior center. I don't know the in-depth explanation of that, but I know that it was definitely affecting my dopamine response
Mhm.
to different things, and it was helping my impulsivity because I'm a pretty impulsive person. Like I might want to go buy something and it doesn't matter what it is, I just need to go shop. And that kind of subsided on a GLP. So I think that there's cutting edge research that is coming when it comes to addiction. And we know that addiction plays a huge role in our health and well being, longevity. And so I think the biggest thing is people can use these on their own, but they just need to make sure that if they are using them on their own, that they're using them properly. And if they need help, there are people that can supervise and monitor, because I really think you need supervision, you need monitoring, and you need ongoing lab work for monitoring, not
Mhm.
only just to know what's going on and make sure there's nothing that is a negative side effect occurring, but to see your labs improve on a GLP is quite amazing. So my Hashimoto's and lupus markers went down, my glucose went down, and my inflammatory markers went down. My cholesterol improved, my liver function. So I had fatty liver. It actually reversed my fatty liver, which is seen on ultrasound because I get ultrasounds every 6 months for cancer recurrence screens. And I was struggling with fatty liver years. And part of that's from alcohol, part of it's from thyroidectomy and all of that, but my fatty liver has been reversed, and that was seen on my last ultrasound that I had. So to see those improvements and see the actual data is quite remarkable.
I feel like enough people aren't doing that secondary research or the blood work to kind of see what else is improving in their body outside of just general body composition. And I think that the way we use them matters so much. You know, you were saying all of the benefits you got out of it, especially in terms of eating habits. Well, I've never had any binge behaviors. I've been very, very fortunate. Good metabolism. I wish I could take credit and say this was all my hard work, but it's my genetics. I've got a good metabolism and I have a good relationship with food. But I will say bodybuilding impacted my food relationship in a way that I never expected. I pushed food for so long, and while metabolically it was very beneficial, I can eat like a grown man. At the same time, I can eat like a grown man. And I would not be satiated. You know, my husband and I would go out for our free meals and we would each order two entrees and finish them. I'm 4'11". There's what? And it brought awareness to my hunger cues. I had forgotten what that was like. I didn't remember what it felt like to be full. In bodybuilding, you eat what you're told. If you're hungry, you're hungry. We didn't have GLPs when I was first getting into the sport, you know? And if you're full, it doesn't matter. Your coach says you're bulking, you push the food. Even if you have to blend your chicken in a blender, you eat what you're told. You are no longer allowed to be responsible for pay attention to those hunger cues, and they get skewed over time. They can be trained to some degree. Awareness of feeling satiated after
Hmm.
an appropriate, normal, human sized meal. I think I was like maybe 8 weeks total that I used the Retta. And this was back in November of 2024. My food volume has stayed the same. It allowed my stomach to return to baseline, and it's a lot more affordable to take me to dinner now. But I didn't realize how my relationship with food had been impacted and how much I was eating. It's a much nicer grocery bill now, but I eat a standard volume of food for somebody my size, and that kind of gave that back to me. That's not even something I realized was ever an issue. It had just become my norm. So I think there's a lot there. You can learn so much about your body, and if you're not outright abusing it, if you're doing it right, those habits will stick with you because you're not on. I mean, obviously you switch from the sema to the Retta. Are you still on the Retta at like a microdose for maintenance, or you've just maintained those habits?
No, it's almost like it's reset something. It's reset my hunger cues. And the other thing that happened on a GLP is I have had to reduce my thyroid medication, and I don't have a thyroid. And I have been consistent on the same dosing for years. Now, some of that is because I lost some weight, but the other factor is because now I don't have fatty liver. It has helped with conversion of T4 to T3, and it likely has helped with my absorption of medication because I've always needed a much higher dose than what is standard for somebody with my height and weight. And so I'm now on a lower dose of T3, which is active thyroid hormone, and I could feel it. Like I was starting to feel super jazzed and like my body was anxious. Thinking something's off here. And my free T3 was a 4.8. So it was, out of range high. And so I was able to reduce. So now I'm on 10 micrograms less of liothyronine. That's an
That's a
effective.
significant drop too.
Yeah, but
And you look
whatever.
incredible, by the way.
Oh, thank you. It's been for once in my life because I've struggled with body dysmorphia and disordered eating and over exercising since I was in high school. And this is the first time in my life, I'm almost 49, where I'm actually comfortable in my body and just with who I am. But that's also a lot of mindset work, therapy work, and just getting to know my body and myself on a deep level. And I think that's something that people have to recognize too, is we walk through life and we're so disconnected from ourselves and from the world around us, and everybody's just trying to survive. If you can truly get to know your body and understand how your body works and understand yourself on a deep level, that's going to help you so much, not only with your body weight and body composition, but also with just accepting who you are and being able to live the life that you want to live. Because, I've wasted a lot of time just trying to be who everybody else wanted me to be and being so stressed about my weight and how I looked. As women, we're just told on a daily basis, you got to stay young, and you can't have wrinkles, and you got to look this way, and it's overwhelming and it's stressful for so many women. And there's so many women just sitting there just unhappy with themselves because of what the outside world is telling them. And it doesn't matter how much weight you lose. It doesn't matter, if you get to a body weight or body composition that you're trying to achieve. If you don't fix what's going on internally, it's not going to make a difference for your life. It's just not.
So, short of becoming your patient, what is your number one advice for anyone out there, whether they are taking this as a bodybuilder, they have PCOS, they're insulin resistant, or they're just wanting a little help, whether they're abusing it as a PED or not? What is your advice to get the most out of this for performance, health, and longevity?
It would be to make sure that you're getting comprehensive labs. And if you're not getting comprehensive labs, at least the baseline labs, a CBC, CMP, lipid panel, your A1C, and also a thyroid panel. But with that, I also think you need adrenal and sex hormone testing and inflammatory markers. You need your vitamin and mineral levels tested, and then treat the body as a whole and make sure that you are on total body care. There's a lot of things outside of GLPs that are essential, like a multivitamin and omegas, and making sure that your iron, your stored iron is optimal. And, there's a lot of things that you can do outside of taking a GLP, and then incorporate your lifestyle management. And it doesn't have to be a 180. If you're driving through every day of the week and you're eating a lot of highly processed foods and you don't know where to start, or you're not working out at all, take small steps and build on those small steps over time. Start with driving through less, and, starting to eat some meals at home and learning how to cook real quality nutrient dense foods. And start with walking, start with getting your steps in. I think walking is very underrated as a form of exercise. We're moving less and less because we're so dependent on technology now. So you've got to get some movement in, and then build from there. Add in some strength training, some type of resistance training, and then make sure that if you are taking a GLP or any peptide or any type of performance enhancing drug, that you are getting monitoring with labs, that you're monitoring your symptoms and your side effects yourself, and also that you know how to dose properly. And I believe that less is more, and always start at a low dose, because you can always build on that. You can always up titrate. The thing about GLPs, you inject too much, you're stuck for about 3 days with those side effects, because they have a 7-day half-life. So it's going to take about 3 days or so for your side effects to wane. And you've got to make sure that if you don't understand dosing, that's okay. There's plenty of us that can help you with proper dosing and can help you with the monitoring of your side effects and symptoms. And don't depend on it as the answer. It is a tool. It is an assist. It is not the answer to your problem. You want to make sure that you're incorporating lifestyle and total body care, and that's how you're going to get the best results. And you've got to know what results you're trying to achieve. And this is
Yes.
true when it comes to training and nutrition, because everybody has a different idea of what they want their body to look like. And you may not want to look like a bodybuilder, which, by the way, if you want to look like a bodybuilder, that's a lot of discipline and a lot of work. But what you want your body to look like determines what your training and nutrition is going to look like. And then that's going to take some time. And then it also will determine dosing of a GLP, and it will determine dosing or the addition of any additional performance enhancing drugs that you add to a GLP.
I think dosing is such a big one, especially now that people are dosing themselves via gray market. Like, do not be afraid to reach out, hire someone for that essential oversight. It's so funny. We're seeing again that crossover of GLPs making their way as PEDs, and then people being more accepting of PEDs. I have so many what I would consider gym pop people that maybe go to the gym for fitness a couple times a month, just they go with their husbands or something. They're not, it's not part of their lifestyle. They're not doing it for health and wellness. It's just kind of an occasional thing. They overdose the GLP. They lose the weight rapidly. They don't get the results they're hoping for because they think the issue is simply body fat. And then those exact same people are in my DM saying, where do I get Anavar? Should I take Anavar? But I'm not at my weight goal yet, but I have more skin because I've been losing 6 pounds a week because I'm not eating. Should I take Anavar for muscle? But as we discussed, if you dose appropriately and you make the lifestyle changes, you retain the muscle. Muscle's not an issue if we are, dosing appropriate for our bodies, our goals, prioritizing macro and micronutrients. Muscle loss really isn't an issue with those lifestyle changes. So you really have to think long and hard. Do you have medical application and you need urgent fat loss to get ready for a surgery and we just need body mass gone? Or are you going for a certain aesthetic? Big difference in those dosing protocols.
Well, and the med spa here that I go to, they have a whole package with their GLPs. They're doing weight loss through their clinic, and they're offering all kinds of services because of the skin elasticity issues that occur, the lax skin, and people are losing their butts and their boobs, and they're having loose skin all over their body
And some of
from.
us don't have anything to lose.
Well, and listen, if you lose weight, you're going to lose some boobs, and they might be a little bit more saggy, but a lot of women are like, I don't like my body now. And I've had a few women say I liked my body better when I was overweight because my skin was filled out. And when we talk about loose skin, it's going to occur typically if you have an extreme weight loss. And a lot of that depends on your genetics as to the degree that you're going to have loose skin. But the more extreme of a deficit you're in, and the less that you're strength training, getting adequate protein and nutrients, the more likely you're going to have some excessive loose skin. And then, you're going to turn around and want to be doing some procedures to try to fix that problem. But butts, for example, I mean, women are losing their butts because you're losing fat. And if you're losing muscle with that, and then you're not training, then you may not like what your body looks like. And that's okay. And some loose skin is to be expected, especially if you have extreme weight loss. If you were 300 pounds or even 250 and you've dropped 100 pounds, that's going to be something that is somewhat expected, but you can also minimize the risk of that with incorporating proper lifestyle habits.
So we know it's being abused. It's being used so much more than what people realize. And not everybody is advertising it on social media that they're
They're
doing it. Not
lying about
everybody's
it
selling
a
it.
lot. Yeah.
But it's growing in popularity. Like, more than likely, we all know many, many people, male and female, that are using these. So outside of conventional candidacy profiles, what do you think people should be most cautious about when pursuing this?
The risk of gallbladder issues, gastroparesis, and other issues that can arise from using them and using them inappropriately. And even if you do use them properly, there's still risk. There's risk with any medication. any peptide, they're a risk. And I think that people need to educate themselves on the risk and pay attention and self monitor for any indications of a problem. And then also just be aware that side effects can occur. And I don't think everybody needs to be on these long term. And that's what we're seeing is people get addicted and then they say they're never coming off. I think people that have struggled with obesity, long-term use is going to be more likely for them. And people who have type 2 diabetes and it just cannot be controlled with diet and exercise, even when they get to goal weight and they've incorporated habits, they may need to be on it long term. There are some people that need to be on it long term. There are many people in the category where they can take it short term, get to their goal weight, and then with the establishment of healthier habits and maintaining those habits, and then also because of what has occurred metabolically and their glucose regulation being much better in their labs, liver function being much better, different things within their labs looking much better, they can maintain that and don't need to be on it long term. Like I said, I don't know if this occurs for everybody, but there's got to be some kind of reset that occurs because it happened to me. And obviously you're mentioning the same thing. And I've seen it in numerous patients where, we see a lot of videos where people say, if you stop taking it, you're going to gain it back and then more. I have not seen that to be the case. However, we are also teaching people about nutrition and exercise. We're teaching them how to get proper micronutrients, macronutrients. So, people need to learn how to take care of their bodies. And I think there's just a lot of confusion because we have so many people saying so many different things. And we need to get back to the basics of exercise and nutrition. It's really not that complicated. And people want to do this diet and that diet. And we need to get back to the basics. And I think a lot of people are just simply confused.
So if somebody, whether they are utilizing this out of medical necessity or they are looking just for a little bit of a performance enhancing edge, how do they find you? How do they become your patient?
So you can find me on TikTok, Instagram. Not a big fan of Facebook, but I'm on there as well. Dr. Jamie Gilliam, Heal Your Body Clinic on TikTok and Instagram, Facebook. It's Dr. Jamie Gilliam. And you can go to our website, healyourbodyclinic.com. You can book a consult. And on those consults, it's me doing all of the consults. We go over any current labs that you have and your health history, current supplements, current performance enhancement or medications you're on. And then we talk about what right now is not working and then things that you can do to start feeling better and getting the results that you want. And then we have different programs available if you'd like to become a patient of ours at Heal Your Body Clinic.
And we will have your links in the description as well. Thank you so much for joining me today.
It's always a pleasure, and I appreciate your knowledge and I appreciate all that you're doing in the health and fitness space.
All right. Thank you.
Bye.